So good morning. In this session, we'll be dealing with the pectoral girdle. So the bones and joints which are involved in the pectoral girdle, the main bones involved are the clavicle and scapula. So this scapula is attached to the sternum through the clavicle. So scapula has no direct contact with bones of the axial skeleton. It's only attached by muscles or indirectly through the clavicle. So sternoclavicular joint and acromioclavicular joints are the chief joints of the shoulder girdle. Shoulder joint is described separately. Functions of the joints of shoulder girdle: they permit the movements of clavicle and scapula, facilitate the movement of shoulder joint in raising the arm above the head. So sternoclavicular joint, it's a saddle type of synovial joint. So bones and articular surfaces, if you observe, it is the sternal end of the clavicle. This is covered by fibrocartilage. So it is convex from above downwards and concave from before backwards. The clavicular notch of manubrium sterni, and also the upper surface of the first costal cartilage. So they are also covered by a fibrocartilage. So both these articular surfaces, they are not perfectly congruent. An articular disc divides the joint cavity into two compartments. You can see here. You can see there is a superolateral compartment, which is also called as meniscoclavicular compartment, and there is a inferior-medial compartment, which is also called as meniscosternal compartment. These are the two compartments found by the articular disc. You can also observe here the articular disc is attached close to superior part of the sternal end of the clavicle, and inferiorly it is attached to the first costal cartilage. You can see here this is the interclavicular ligament which extends between the two clavicles above the suprasternal notch. You can also see this is the costoclavicular ligament. You can see this is the part of the fibrous capsule. Here you can see the conoid and trapezoid part of the corococlavicular ligament, which is involved with the acromioclavicular joint. You can see the capsule of the acromioclavicular joint, and this will be the acromioclavicular ligament. You can see the coracoacromial ligament. So let us go back. The ligaments which are strengthening the sternoclavicular joint are the capsular ligament, the anterior sternoclavicular ligament, the posterior sternoclavicular ligament. The capsular ligament is attached to the articular margins. The capsular ligament will be attached to the articular margins, and anteriorly and posteriorly the capsular ligament is thickened to form the anterior sternoclavicular ligament and posterior sternoclavicular ligament. Then articular disc, as I said earlier, the articular disc is present here. It is also made up of fibrocartilage. It divides the joint cavity into two compartments. There's a superolateral compartment called meniscoclavicular compartment and an inferior-medial compartment called meniscosternal compartment. And there is interclavicular ligament. You can see here there is the interclavicular ligament, and you can see there is costoclavicular ligament. This is the costoclavicular ligament. It is having two lamina, anterior lamina, posterior lamina. Above it is attached to a rough ridge on the inferior aspect of the medial end of the clavicle, and inferiorly you can see it is attached to the first costal cartilage and first rib. The anterior lamina is directed upwards and laterally, and the posterior lamina is directed upwards and medially. So both the lamina fuse laterally, whereas both lamina are separated by bursa on the medial aspect. Costoclavicular ligament. So these are the ligaments: capsular ligament, anterior and posterior sternoclavicular ligaments, articular disc, and two compartments formed by the presence of articular disc, interclavicular ligament, and costoclavicular ligament. The arteries which supply the sternoclavicular joint are the internal thoracic artery and suprascapular artery, and the nerves which supply are the medial supraclavicular nerve and outer subclavius. Now, if you see the acromioclavicular joint, the second part of the shoulder girdle or the pectoral girdle, the bones forming it are the lateral end of the clavicle. Then the clavicular facet on medial margin of the acromial process of the scapula. So both are oval and they are covered by fibrocartilage. The fibrous capsule is attached to the articular margin, the periphery of the articular margin. Then the acromioclavicular ligament is the thickened superior part of the fibrous capsule. Then there is coracoclavicular ligament, conoid part and trapezoid part. You can see here the conoid part is inverted cone shaped. Inferiorly it is attached to the coracoid process. Superiorly it is attached to the conoid tubercle. Here it is attached to the coracoid process. You can see the shape. The conoid part is inverted cone, whereas the trapezoid part is quadrilateral. So trapezoid part is inferiorly attached to the upper surface of the coracoid process, and here it is attached to the trapezoid ridge of the clavicle. So here you can see this is the joint capsule. This will be the thickened upper part of the joint capsule. So that thickened part is called as acromioclavicular ligament. Here you are seeing an additional ligament, coracoacromial ligament, which is not directly related to the acromioclavicular joint. The arteries which supply the acromioclavicular joint are the suprascapular artery and the thoracoacromial artery. Nerves which supply are the suprascapular nerve and the lateral supraclavicular nerves. So now let us coming to the movements of the shoulder girdle. We did not consider the movements of the sternoclavicular joint and acromioclavicular joint together separately. Now we are considering them together as the shoulder girdle. So mainly it is the scapula which is moving, whereas clavicle is adjusting to that movements or permitting and facilitating that movements. The scapular movement is in the form of gliding as well as rotation. The gliding movements are elevation and depression, protraction and retraction. And the rotative movements are forward rotation and backward rotation. This is expressed by the movement of the inferior angle of the scapula, the swing of the inferior angle of scapula. So elevation of the scapula, it is visible in shrugging of the shoulders. The muscles are upper part of the trapezius and levator scapulae. So these two muscles are involved in elevation of the scapula, whereas depression will be passively by weight of the upper limb, but if you want, depression also can be produced actively by lower part of serratus anterior and pectoralis minor. So you can observe here, this will be the elevation and depression. At the same time, you can see there is movement of the medial end of the clavicle within the sternoclavicular, the meniscoclavicular compartment. So within the meniscoclavicular compartment. And see, this is the axis. Above the attachment of the costoclavicular ligament, there is an anteroposterior axis around which this movement is occurring. Elevation and depression of scapula is occurring. I know the scapula is being elevated and depressed. At the same time, the clavicle is also moving in accordance with the movement of the scapula. So protraction of scapula, it is mainly done by serratus anterior and pectoralis minor. It is also assisted by the latissimus dorsi. So throughout this movement, the scapula is just kept approximated to the chest wall. So retraction of scapula is performed by the middle portion of the trapezius and rhomboides major and rhomboides minor. You can see here, this will be the forward movement protraction, and this will be the backward movement retraction. So if you see in this diagram, so the retraction, the muscle should be attached somewhere here. For protraction, the muscle should be attached anteriorly. At the same time, if you observe, this axis is here only. The protraction retraction is performed around a vertical axis, which is passing at the same point. But observe the movement. In earlier elevation and depression, the movement of the medial end of the clavicle was in the meniscoclavicular compartment. But here in protraction and retraction, the movement is within the meniscosternal compartment. Meniscosternal compartment. So forward rotation of scapula, it is mainly performed by upper part of trapezius and lower part of trapezius, that is upper fibers and lower fibers of trapezius, along with lower fiber stations of serratus anterior. Whereas backward rotation, so actually the active lengthening of the trapezius and serratus anterior itself will restore the resting position, but the same backward rotation can be actively performed with the chopwood action of pectoralis minor, levator scapula and rhomboids, and is also assisted by gravity. You can see here the upper fibers and lower fibers of trapezius and lower fiber stations of serratus anterior, they are helping in the forward rotation, which is predominantly observed by the forward swing of the inferior angle of the scapula, where the glenoid cavity will face vertically upwards. So backward movement will be performed by these muscles, pectoralis minor, levator scapula and rhomboids. So you can see levator scapula and rhomboids are attached here. So this, when they pull it back, there will be backward rotation. So this is the most important point. In all movements of the scapula, the clavicle is kept steady by contraction of the subclavius muscle. So one clinical point here, if you observe, in dislocation of the acromioclavicular joint, the acromial process is driven below the lateral end of the clavicle. So this is due to the direction of the articular facets of acromioclavicular joint. The clavicular facet faces downwards and laterally, whereas acromial facet faces upwards and medially. So always in acromioclavicular joint dislocation, the acromial process will be driven below the lateral end of the clavicle. Thank you.